Hello, everyone, and welcome to our session for today. I hope that all of you are managing very, very well. My name is Dr. Sahar Ali. I am the founder of PLAB 2 Warriors Groups. I work in the NHS in acute medicine. I am a simulation faculty for the junior doctors in my trust. Also, I am a PLAB 2 instructor for more than 4 years now. Through this period, I helped hundreds of doctors to pass through the services that I provide, which are the full course, the practical course, the one-to-one mocks. Recently, I resumed the free mocks in a renovated format. This will be in the form of teaching sessions on a specific topic. These teaching sessions will be added to a new series of videos named Teaching Gems. After each teaching session, there will be a mock session on the topic discussed. This will help you consolidating your knowledge and technique in that particular topic. Hopefully, you will find them super helpful and beneficial, inshallah. And anyone wants to know about my courses, please stay till the end. Let's get started. So what's our plan for today? We will have a mock session on falls. We have discussed falls in the last session, which is the teaching gem of falls. Today, we will have a mock session on falls. We will have 4 cases with different doctors. After each case, I'm going to give my feedback to each different doctor, and then we will discuss the case. Okay? We are going to start with Dr. Bathoumi. All right, Dr. Bathoumi?
Yeah.
What would you like me to call you? Bathoumi is fine, or
Yeah.
any other? Again, please.
Bathoumi, yeah, fine.
Okay, no worries. Okay, Bathoumi. All right. So we will start with you. And if you don't mind, if you can prepare yourself to switch your camera on, and I'm going to switch my camera on because this will help me in giving you the whole assessment on your body language and on your performance as well. Is that okay with you?
Okay, I'll try.
So, hello, how are you?
I'm good. Thank you, doctor. How are you?
I'm fine, thank you. Everything is okay. Okay, so what will happen now is that I'm going to share the screen to read your question, okay? You will have 1.5 minutes before starting the station, okay? Read your question carefully, find out your task, okay? And then we are going to start after 1.5 minutes, all right?
Okay.
We will do the station within 8 minutes. After that, I'm going to give the comment about your performance, okay?
Okay.
All right. Any question before we start?
No, doctor.
Okay. So I don't mind if you do any mistake. Do whatever mistake you want. Okay. It's better to do your mistakes now instead of doing them in the exam. All right?
Yeah, thank you.
Okay. All right. So let's get started. Let me share the question with you.
Begin.
Start.
Bathoumi Fernando, GLC number 12345. Hello.
Hello.
I'm Dr. Bathoumi Fernando, one of the doctors. Am I talking to Mrs. Catherine Hyde?
Yes, I'm Catherine Hyde, doctor.
How would you like me to call you?
Fine.
Catherine.
Catherine is fine, yeah.
Okay, thank you. Could you kindly confirm your age for me, please?
80.
Okay, so I can see from my notes that you have been admitted to the hospital after a fall. Am I correct?
Yeah, I had a fall 3 days ago. Yeah.
And you have underwent a surgery as well. Yeah?
Yes, yes.
Okay. So how are you feeling right now?
I'm feeling better. I have just the pain of the surgery, but yeah, I can cope. Yeah.
Okay, that's good to hear. Okay. Have you been mobilized or not yet?
Yeah, yeah. They encouraged me to walk around in the ward. Yeah, yeah.
Okay, good, good. So I'm here to discuss with you about what happened, just to make sure that things are all right once you go back and to make sure that everything will be fine. Okay.
Yeah.
So would you mind if I ask you some questions?
Yes, of course.
Okay. Regarding the fall, can you describe what happened?
Actually, I was cooking uh,
Uh-huh.
in the kitchen, and then my leg gave way, and I slipped over. Yeah,
You just slipped over.
my leg gave way and slipped over. Yeah.
Mhm. Um, was it due to like you didn't see something on the floor or something like that? You
Yeah,
said,
yeah, yeah. I was turning around, and my leg gave way and it fell down. Yeah.
okay. Was it like dizziness or something?
No,
Oh,
no, I didn't feel any dizziness. No,
no fainting or nothing?
no,
No. Okay. All right. So, were you alone by that time?
no. My husband was there.
Okay. Okay. Did you feel anything before the fall, like that you're gonna fall? No. It was
No,
just slipping and falling. Any heart racing before that?
no.
Okay. Did you had your meals before that? You were
Yes.
okay.
Yeah.
Okay. Okay. And any visual disturbances or anything like that? Did you see anything?
No,
No.
no,
Was the lighting not good?
no,
No. Was the floor slippery? Was it the reason?
no,
No.
no, no. It's not slippery. No.
Okay. Okay. All right. So what happened after the fall?
I just fell down, and my husband rushed to me and called the ambulance, and we went to the hospital after that.
Okay. Did you had any impact on your head when you fall?
No,
On
no,
your head? No.
no,
Did you lose consciousness?
no at all.
Okay. Okay. So you can remember everything what happened during and before and
Yeah,
after.
yeah.
Okay. Good. Good. Okay. And what about your past medical problems? Are you on any medical problems diagnosed?
Yeah, I do have high blood pressure.
Okay. For how long?
6 years now. Yeah,
Okay. Are you on regular medications?
taking amlodipine. Yeah,
Amlodipine.
yeah,
Okay. Okay. You're taking them as prescribed.
yeah.
Mhm. And any over-the-counter medications?
No,
Okay. And are you having any family history of any heart problems or anything?
mm, not that I'm aware of.
Okay. Any epilepsy? No.
No.
No. Okay. And do you exercise?
Um, I just walk around.
Okay. How about your diet?
My
Did
diet's
you say?
okay. Trying to
Oh,
eat healthy.
okay. Okay. And do you drive?
No.
Okay. Okay. So so are you living with your husband?
Yes.
Okay. So is your husband supportive?
Yeah, yeah, yeah.
Oh, that's good. So you plan, so once you go home, your husband will be helping you. Is that the plan?
Yes, yes. You will
Is
help.
there
Yeah.
any other support available?
Yeah, my children as well.
Okay, good, good. Okay. And do you smoke or take
Mm,
alcohol?
no.
Okay, that's good. Okay. So I would like to take examine you if that's okay with you to take your pulse rate, blood pressure,
Mm-hmm.
and oxygen levels. Would that be all right?
Yes.
Two minutes remaining.
Okay. So thank you very much. From my from the discussion and the examination I did, I can see that your blood pressure is dropping when you get up. Okay. So we call this postural hypotension. Have you heard of it?
No.
So it's a condition where your blood pressure drops when you get up from your lying position. Do you
Okay.
understand?
Yeah.
So the best, I would like to advise you on, so that was the reason for your fall. When your blood pressure drops, you feel you just, you can fall down. So
Okay.
I would like to advise you in the future, when you get up from bed, we say, you have to sit on the bed and wait for a while and get up gradually. Okay, so that your body adapts to the dropping of blood pressure and you'll be fine. Do you
Okay.
understand?
Yes, I do understand that. Yeah.
Yeah. So you have to do it whenever you get up from lying position or sitting position in future.
Okay.
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 And apart from that, once you go home, I would like to send send occupational therapist to see your home, to see if your house needs any arrangements to make sure that you function fully, because now you are after the surgery. So they will assess your home environment and they will provide you with any
Move on to the next station.
Time's up.
thank you very much.
Okay. Okay, very good. All right. Thanks for your participation, Dr. Bathumi. So, yeah, how do you feel?
Um, I'm not sure, Doctor. I didn't had proper structure or plan. I didn't do this standing and lying blood pressure as well, even though you gave me I
Yeah,
just did blood pressure. So
yes, you didn't mention it. Okay, yeah.
yeah,
And what
yeah.
else? What else?
And I actually didn't had any idea about this station. I haven't had a read or anything about this. So I was just going with the flow.
Okay. This is a good thing. Yeah. I'm happy
Yeah,
with this. Yeah. Yeah.
thank
What else?
you. And I think I would have had some more time for management. I just started with the 2 minutes bell ringing.
Yeah.
So I I didn't had enough time to manage.
Okay.
Yeah.
Okay. Anything else?
Mm, yeah, that's it. So the management was not complete.
Okay. All right.
Yeah.
Okay. Okay. So, yeah. All right. So, first of all, um, I'm happy with
Begin.
the overall performance. Let me talk first about uh, what are the positives in your performance, okay? And then we can talk about what you missed and what should be done to do it better if you have it in your exam, okay?
Yeah.
So this is the assessment criteria based on the GMC, okay?
Mhm.
I'm going to assess you quantitatively and qualitatively. Quantitatively, the marks on the
Yeah.
data gathering, the management, and interpersonal skills. The qualitative is the skills area, uh, uh, the thing that you know lack in your performance in terms of these skills areas. All right. Okay. So generally, I'm happy with your, you know, your facial expression, your tone of voice, your body language, the eye contact as well. So I'm happy with these. I don't have any comment on them. Okay.
Mhm.
Also, you were organized in taking the history in terms of taking the present history, then the past history, then the psychosocial, then you went to the examination and the management. Everything was organized. So the consultation was organized. Okay. The way you explored the causes was very good. Okay, was proper. You missed only the examination part and the investigations. Okay. Always think about the falls that in especially in elderly people, it's multifactorial, not only one cause. Okay. Maybe this patient has low hemoglobin. Anemia can cause falls in people. Also mechanical cause as well. It could be a cause. She told you, my leg gave way and I slipped. Okay, so maybe there is a problem in the tone of her legs. Okay, maybe she slipped over. Okay, so there are many causes. So it's multifactorial, especially in old people. Don't give them one cause. All right. Okay, so you will give them what you think about, but you will mention that we will need to exclude other causes. Okay, by doing more investigations. All right. It could be something related to the heart, so we can do ECG. Yeah. Okay. So these are the things that you didn't mention in the data gathering. All right. What else? The way you explained the cause of the fall, I mean the diagnosis was okay-ish, so you've done it really well. Okay, but I would love if you just give me a kind of differentials, not only one cause. All right. In the management, you concentrated on the advice of moving gradually and these things, but you didn't talk about what we are going to do for you. Okay, I mean, as doctors in the hospital, what are we going to do? So we will need to do some investigations. We also need to review your medication. Maybe your medication is a high dose, so we can lower the dose. What else? The other investigations, as I mentioned. Okay, then you talked about the OTPT team, which is a really nice thing because she's 80 and you have to think about her safety at home. So this is a very nice thing. Okay. If you will have time, you can talk about the, safety at home, making sure that she walk around safely and these things. Okay, but you didn't have time. You didn't complete the management. All right. Okay. So this is in general, in terms of your body language and in terms of the positives and the negatives in your performance. All right. So if we talk about the data gathering, in terms of the data gathering, you've asked almost all of the points in terms of the history taking. Okay. But I was concerned about asking diet, exercise, and smoking. Would it be helpful in this case?
Not really, doctor.
Okay. So
yeah,
no need to mention them or no need to touch on them as long as they are not going to help you in the management. Okay. So save your time for the more important things. Okay. So if you don't ask these questions, you would have time to talk more in the management. All right. So diet, exercise, smoking, and alcohol are not that important. You didn't ask me if this happened before or not. Is it recurrent fall or not? So patient has recurrent fall, so she has high risk. So you have to be, cautious and, in this case, it's once or only one fall, and she has support around her, her children and her husband. Okay, if you don't mention the OTPT team, it would be, they might forgive you. Okay, but if it's recurrent fall and the patient is old in age, she is living alone, she doesn't have any carer or anything like this. So if you don't mention OTPT team, this will be a big problem. Okay.
Yeah.
The psychosocial part, I was happy by the question that you asked. Who does she live with? Is she driving or not? You can add, how is she moving around?
Before.
She's 80 years old. She's old age. So
Mm.
how she's getting about or moving around? Okay.
Mhm.
What you missed is ideas, concerns, and expectations, which is really important. Okay. You ask her, do you have any idea about what might be causing the fall? Do you have any concerns at all? I was concerned, if you ask me this question, I will tell you, doctor, I am very concerned about going out. I used to go out with my friends, so I'll be afraid of going out. So, what do you suggest, doctor? Okay, so this is an important thing. This will maybe deduct mark in the data gathering and the interpersonal skills. All right. Examination and investigation. You didn't verbalize all the wanted examination and all the wanted investigations. Okay. We are going to talk about the things that important in the examination and investigations in this case. Okay. So in data gathering, I would give you two. Okay, two in the data gathering. So let me, if we can, yeah. So two in the data gathering. Okay, in the management skills. You succeeded in getting into the management. You gave me the diagnosis, part of the diagnosis, and some points of the management. So I would give you two in the management. Okay. Interpersonal skills. I'm happy with your body language, with your eye contact and the explanations and the relationship between you and the patient. It was nice. Okay. So I will give you 3 in the interpersonal skill. Okay. So 1, 2, 3, 4, 5, 6, 7. So 7 in this. Okay. It's a little bit risky, to be honest. So 6, 7, 7 and below, a little bit risky. Okay. Sometimes you give 5 and pass. Okay. But we aim for 9s, 10s, and 11. But in general, your performance is very well. Okay. You just need to think about these small points, thinking about the only important questions, and then in the management, you take the thing as a whole thing, not only one diagnosis. Give differential. Okay.
Yeah.
All right. In skills areas, I will give a tick in the management, and a small tick in the diagnosis. Okay. Right.
Yeah.
So this is in terms of your performance. Do you have anything to add? Anything you'd like to ask?
in this case, doctor, I'm just asking, I know we can't assume things since she has undergone surgery as well. So probably they would have done all the investigations, ECGs and everything, ECG. So do we still need to do ECG because the findings are not given to us?
This
Yeah.
is a very good question. This is a very good question. So you can tell the patient, I will revise or I will review your ECG and your bloods. Maybe you have a kind of something related to, medical problem causing this fall, because your task is finding out the
Yeah.
cause of the fall. All right.
Yeah.
I do
Yeah.
agree with you that this patient will be admitted and they've done everything. So you can tell the patient, okay, I will review your investigations. Maybe you have a kind of something else in addition to the postural hypotension.
Okay. Because when it came to investigation, that thing just came through my mind and
Yeah,
I
yeah,
wasn't sure. Yeah.
yeah. This is I was happy with your question. Okay, so yeah, you can tell her,
Yeah.
review that, and maybe you have another cause of fall, because your task is finding out the cause of
Yeah.
the
Sure.
you,
Sure.
you don't have enough information about the patient, or about the investigations, about the whole case. So you have to think broadly in this case, especially in old people. In old people, the faults are multifactorial, not only one cause.
Yeah. Yeah.
All right, you got it?
Yeah. Yeah. Thank you.
Okay, okay. Any other question before we move?
No, doctor, that's all. Thank you very
Oh,
much.
good.
It's really
So
helpful.
very good performance. Keep it up. You just need to focus on the important points in the data gathering. So take home message in the data gathering. Think focus on the important points. If personal history is not important, I mean diet, exercise, smoking, and alcohol will not help you in the management, don't mention them. Family history as well is not that important here in the case. Okay, so focus only on the points that will give you marks: ideas, concerns, and expectations, verbalizing the investigations, and the examination. Okay, so in examination, you tell the patient, all right, I would like now to examine you, check your observations, especially your lying and standing blood pressure. Okay, and I will examine your vision, balance, and heart. Okay. In addition to that, if you want to say, I will review your investigations or your bloods and the heart tracing.
Yeah.
Okay. Then you tell the management. So this is in terms of the data gathering, how can you improve you can improve the data gathering. In the management skills, always think about the management as it is mutual responsibility between you and the patient. So you will do things, the patient will do things, all right? So if you just give a frame to the patient about the management after giving the diagnosis, tell the patient, okay, let's talk about our management plan. Let's talk about what we can do for you and what you can do for yourself as well. Okay? In terms of what we can do, we, as I mentioned, I will review your investigations. We also might need to review your medication, your high blood pressure medication. And lastly, involving the OTPT team to make sure that when you go home, everything is safe. Okay. In terms of what you can do, it's very important to move slowly, don't get up suddenly, and these things. And you can give him leaflets about this. So you can tell him, all right, I will give you a tip, and then I would add some leaflet or give you some leaflets to read more about the postural hypotension and how to deal in this case. All right. If she is driving, she doesn't drive, so you can tell her it's highly advisable not to drive or to avoid driving, you know, until we find out what is the cause and treat it and these things. Okay. All right. So always give a frame, what we can, what he can, or what she can, and then you can tell him after that. If you have time, we will arrange a follow-up for you in the GP clinic. Okay. So this is how to think about the management, organized, to the point, and the patient will also be, you know, happy to hear about the management. Everything is organized to him. Okay. All right. No more advice on the interpersonal skills. Just don't forget ideas, concerns, and expectations, and always think about them after the examination.
Okay.
After or before, it's based on your preference. But before you get into the management, you have to know what are the concerns of the patient. All right? Got it?
Yeah.
All right. Okay. So yes, you can switch off your camera if you want, and me too. All right. So let's talk quickly about the case doctors, and then we can take that next one. I would like to read the question quickly with you. So this is the question. Who are you? You are FY2 in the surgery department. Who is the patient? Mrs. Catherine Hyde, aged 80, 80, huh? 80 years old. So always think in falls about the age. Be minded about the age. Always the patient will be, or most probably the patient will be old in age, and the cause will be multifactorial. Okay. You have to think about the psychosocial part, please. Okay. Aged 80, has recently had a fall and fractured the neck of the femur. She underwent a total hip replacement surgery. Additional information, your consultant has asked you to take history and find out the possible cause behind the fall. Your task, please talk to the patient, take history, find out the cause of the fall, and discuss about the management plan with the patient. So this is your task. Take focused history, find out the cause of the fall, and discuss the management plan with the patient. If you don't manage to do these three things, your marks in the case will be very low. Okay. In terms of the examination part, they might provide you with the blood pressure standing and lying. The difference here is 20. So if it's 20, you think about postural hypotension. Okay. The other vitals are within normal range. The wound is clean and dry, no tenderness, so no problem in terms of the wound. Okay. So what are the cores of this case, or the issues that you need to focus on in this case? Firstly, you have to find out the cause of the fall from the history taking and the examination and investigations. Okay? Then you have to touch on the psychosocial part. Who does she live with? Who is looking after her? If she is dependent, how she is moving around, is she driving or not? And also the safety at home. How is her home condition? All right. So this is the psychosocial part. The third issue is the management. In the management, you have to manage the cause, and you have to talk about the surgery, the aftercare of the surgery. Okay, touch on this. So find out the cause from the history, examination, and investigations. Touch on the psychosocial part, manage the cause, and touch on the aftercare of the surgery. All right? So in the history taking, I'm not going to dwell on the causes because we have discussed that in the last session. If you would like, you can watch the video again in the Teaching Gym playlist. All right. So you will try to find out the cause of the fall by asking the present history questions. She told you that she has prolonged standing. She was cooking. She has high blood pressure and her leg gave way. So it might be something related to the blood pressure. It might be something related to a mechanical fall. All right. Then in the past history, you have to ask if there is any medical condition. She might tell you, I do have high blood pressure. So I'm going to talk about this particular case. All right, doctors? In the exam, you might have a different thing. Based on what you have, please deal with it. Okay? So in the past history, you have to ask about if she has any medical condition, any medications that she is on. What else? Did that happen before or not? Did that happen before or not? To exclude recurrent falls. Then, in personal history, not very important. You can skip it. Don't ask about diet, exercise, smoking. You can add alcohol if you didn't ask about alcohol from the start, from the present history. Okay? 4 P's is not important at all. Psychosocial is extremely, extremely important. Please, doctors, ask psychosocial history. Who does she live with? Is she dependent or not? If she is dependent, who is looking after her? Is there any carer involved or not? How she is getting about, moving around or getting about. Okay? Then ideas, concerns, and expectations. After that, in the examination, in any fall, you think about the vitals, especially the postural hypotension. Especially the lying and standing blood pressure. And what else? The neurology, balance, and vision. In addition to heart, neurology, balance, and vision. Okay, everything is explained in the previous session. So please watch it if you didn't watch it. Then in investigations, what you think about? You think about the bloods, full blood count, and ECG, heart tracing. All right? Then your management. In this case, you have 2 differentials. The first one is postural hypotension. The second one is what? Mechanical fall. So how are you going to give her the diagnosis in a proper way? You tell her, all right, Mrs. X, you had a fall and you told me that you were cooking, so this is a prolonged standing. You have high blood pressure, and when I examined you, I found a difference between the lying and standing blood pressure. This means that you have something called postural hypotension. Have you heard about this? No, doctor. So it's a kind of the change of your blood pressure or falling of your blood pressure when you change your position suddenly or when you are standing for a long time. Okay? This is one of the possible causes of the fall. The other one is mechanical fall. You told me your leg gave way and you slipped over. In addition to that, we will need to exclude other causes of fall. So that's why we need to do some investigation, or that's why I need to review your investigations and your heart tracing. Okay? Okay, Mrs. X? Yes. You were concerned about going out with your friends. I totally appreciate your concern. It must be scary that you have, when you have a fall, it's scary. But don't worry. We are here. We will help you to find out what is the cause. So after that, you can go with your friends when you have a full recovery from the surgery. All right, Mrs. X? Yes, doctor. Okay, so let's talk about our plan of management. What we can do and what you can do. In what we can do, you will investigate, you will review her medications, you will involve the OTPT team. What is the OTPT team? Occupational and physiotherapist. Okay? They will do some strategies to make sure that your home is safe. They will find out if you need any carer or not. So they will make sure that you are safe when you go home. All right? In terms of what you can do, be careful, please, when you walk. Try to move when you get up. Don't get up suddenly. And I can give you leaflets to read more about postural hypotension and how to prevent that from happening again. And please try to follow the advice that they give you about the aftercare of the surgery. Okay? These are the things that you can talk about in your management in this particular case. In this particular case. Okay? Any problem with that, doctors?
Dr. Sarah, can I ask a question, please?
Is it related to the case?
Yes, this case.
Yeah.
I couldn't understand that why we need to do more investigation, because it seems that she has a postural hypertension.
All right. This is the same question that Dr. Bathoumi asked. All right.
Mm-hmm.
As I mentioned, Dr. Isra, in old age, the cause of the fall is multifactorial. Yes, you can tell her that you have postural hypotension and it could be mechanical problem, but we will need also to find out maybe you have low hemoglobin, or you might have anemia. Your ECG as well, maybe there is a problem in your ECG. So you don't have this information, so you can't tell her only you have postural hypotension. Got it?
Yeah, thank you very much. Got it.
So if you tell her postural hypotension, it's okay, but you have to tell her other differentials. You have to show that, yes, I'm thinking broadly. Okay? So this is how to get high marks. Dr. Bathoumi got 7 in the case. She gave me a right diagnosis. She talked about the management, but what if she tell Mrs. X, you might have postural hypotension, but we will have to exclude other medical causes of fall. So we will review your medications and we will review your investigations just to make sure that everything is okay with you. Which is better, doctors? The first one or the second one? The second one. Okay. If you give me one differential, so you might pass the station. I don't tell you that you are going to fail the station. No, but when I give you the management, or when I give you the issues of the case, I aim for 12s. All right? Okay, hopefully that helps. So let's do the next station. Dr. Abdurrahman, I think.
Begin.
Hello, GMC number 7677854. Hello.
Hello.
I'm Dr. Umar, one of the doctors in Accident and Emergency Department. Can you kindly confirm your name and age, please?
I'm Joan Smith, and I'm 75 years old.
Okay. And how would you like me to call you as we discussed?
Joan is okay.
Okay. John, I understand from your notes that you have some repeated falls. I'll be talking to you about that and see why you're having those falls. Okay?
Okay, doctor.
Okay, John. What can you tell me about this fall that you've been having?
I have recurrent falls recently, doctor. I fall down a lot. I don't know what's going on.
Well, I'm sorry that you're going through all of that. We are here to support you. But how many falls have you had recently?
Maybe 3 or 4 falls, as far as I remember.
Okay. The last fall you had was when?
Last week.
Okay, last week. Can you tell me what were you doing when you had this fall?
I think I was working in my garage, doing something. Can't remember, to be
Okay,
honest.
okay, it's okay, it's fine, it's fine. John, by any chance, did you sleep before you fell?
No.
Okay. Well, was your heart racing?
Again, please.
Was your heart racing? Was your heart,
Heart
was it racing?
racing. No, I can't remember something like this.
Okay. Do you have any headache?
Yeah, I do have headache, doctor. Yes. Yeah, I do have
Oh,
headache.
okay, John, please, can you tell me more about this headache that you're having?
It just started maybe a few months ago, and it's persistent all of the time.
Okay. Sorry that you're going through all of that. That must have been a lot for you to bear. But we are here, we'll surely help you. John, this headache, if you have to score this headache on a scale of 1 to 10, 1 being a very mild headache, or 1 being a very mild headache, and 10 being very severe, what will you give this headache?
Maybe 5.
Okay, okay.
Yeah.
Will you be able to, are you having headache now presently?
Any?
Do you have headache now?
Yes.
Are you having this headache? Okay.
Yeah.
Okay, I'm sorry about that. Will you be able to continue this consultation?
Yes, doctor.
Okay, I'll pass it up at the end of the day. I'll be able to help you out. Ed, do you vomit, especially in the morning?
Yeah, I vomited many times, especially in the morning.
Okay, I'm sorry about that. And when you fall, how long does it take for you to get up?
Maybe 2 to 3 minutes.
Okay, and was there any time that you lost consciousness?
No.
Okay, and do you have any abnormal movements?
No.
Okay, and by any chance, when after the fall, are you always any drowsiness after the fall?
No.
Okay, do you have any problem with your vision, John?
Yeah. Lately I have blurry vision. Yeah.
Okay, I see. And any chance you notice that you have any weakness on any part of your body?
No. No
Okay,
weakness.
okay, John. John, I'm going to be asking you 3 questions about your general health and well-being. Okay, have you been managed for any medical condition?
No, I don't have any medical condition.
Okay, and the other falls that you had, did they also happen similar fashion like the recent fall?
Before?
The other falls, the previous falls that you had, did they also follow the same pattern like the one you had recently?
Yeah.
Okay, okay. Are you on any medication?
No.
Okay. And John, do you have an idea what you think might be causing these falls that you've been having?
No idea at all, doctor.
Okay. And what is it that concerns you the most about everything that is going on?
I need to know why do I have these falls and why do I have this headache?
Okay, John, we are here to do that as our aim, and we'll be surely be working towards that to see what is causing this headache. Okay, it's causing this fall. Okay, John, you've been having these falls now for quite some time. How has this affected your life generally?
Actually, I'm living alone, doctor. And yeah, I'm fearful of having another fall. No one will help me.
Anyone in your show would also be scared of having these falls. But we are here and we'll surely do something about it. Okay. Okay. John, do you try?
No, doctor.
Okay, I see. Thank you so much for answering my questions. I'm going to be examining you to just make sure that everything is fine. That would involve me doing general physical examination for you. I'll also be checking your vitals, particularly I'll be checking your blood pressure to
2
make sure that
minutes remaining.
on that. I'll also be checking your nervous system. I'm to check the nerves of your body. I'll be fully examining your eyes. I'll also be listening to your chest, okay? And I'll be doing a bedside ECG just to make.
Okay.
Okay, John, from our discussion so far, the fact that you're having headache and you've been having these repeated falls over, and also the fact that you talked about the fact that your visions have become blurred recently. I'm afraid that we might be dealing with what we refer to as space occupying lesion. Do you know anything about
No, doctor, what is that?
that? Okay. Space occupying lesions, I'm afraid I'm the one that's giving you this news. It might be tips that is something in your brain that's probably occupying a space in your brain that's resulting in the headaches that you've been having repeated and also the falls that you've been having. However, we will do other tests to just make sure that we're not missing out on anything. Okay?
Do you mean that I do have cancer in my brain, doctor?
Okay, we are not sure yet what that is, but what we are going to be doing is that I'm going to be involving my senior to also have a look at you, and we'll be doing further imaging of your brain to make sure that you're not missing out on anything. And depending on that, we would determine the next course of action. How does that sound?
Okay, doctor.
Okay, do you have any concerns now that you'd like us to address before we continue?
No, doctor.
Okay, I'll be inviting my seniors. I'll also be inviting the specialists that would come and also talk to you and assess you and do other investigations to just make sure that you are fine.
Move on to the next station.
Time is up.
Okay.
Okay.
Okay. Thank you very much.
Okay, no worries. Okay, thank you, Dr. Abdurrahman. So, how do you feel?
I think I rushed the management a little bit. Management wasn't kind of organized in my view.
Mm-hmm.
Then apart from that, I don't know if I gathered a lot of data that needed my time to manage my patients appropriately.
Mm-hmm. Okay.
Okay. Then, okay, this patient, maybe I was unable to give, because he told me that he's having headache. I should be able to give paracetamol, the painkiller or something for the pain that he said he's having.
Okay.
Which would have been very important here.
Mm-hmm.
That's the things I can.
Anything related to the interpersonal skills?
Interpersonal skills. I think maybe it wasn't more of, I was kind of asking most of the questions in a way. I don't know if that's what it is. I don't know.
Okay. All right. So, did you find that you just give me the diagnosis without giving me some pauses or
Emotion.
giving it in
Begin.
a sensitive way? Is it something simple to say to the patient that you have growth or something in your brain?
Mm.
It's a little bit complex, or maybe a kind of bad news to the patient, right? So just try to be a little bit sensitive when you give it to the patient. So you tell him, all right, so you told me that you had recurrent falls and you have this chronic headache with blurry vision. I'm concerned about something related to the inside of him. And give a small pause. Okay? When you give a kind of big problem to the patient, just give him time to understand by giving pauses, okay? And also tell him, I'm really sorry for you to hear something like this. It might be shocking for you, but we didn't confirm yet. Okay? So always be sensitive with the patient always show your sympathy to the patient, okay? It's not about only giving the right diagnosis, it's giving the right diagnosis in a proper way, okay? So this is what was concerning me in your interpersonal skills. You have asked me ideas, concerns, which is really, really good. And you commented on my concern, which was really nice from you, okay? But what was concerning me is the way you gave me the diagnosis, okay? It was lacking some, interpersonal skills,
Emotion.
lacking some sympathy, all right? This is what was concerning me, okay? So in terms of your body language, your body language is okay. You have a very good eye contact, but it would be better to start your station with, a kind of a smile, especially the patient is old man, okay? So always with old people, try to start the station or try to start the conversation with a very nice smile, okay? So this will build a very good relationship between you and the patient and will give you high marks in the interpersonal skills, all right? The patient doesn't know anything now before giving the diagnosis. He doesn't know that he has problem in his brain. He doesn't know anything. So you can start the station by a smile, okay? So you can tell him, okay, hello, how are you? I'm Abdurrahman, one of the doctors in the A&E. How are you doing today? Is everything okay? How is the weather today? Do you find it a good weather today? So start with a kind of rapport with the patient, then take your history, okay? So this is in terms of your body language, only smile. When you talk with a smile or with a friendly way, this will help you throughout the case. Okay? This is the only thing that I could comment on your body language, but otherwise everything was okay. All right? This is in terms of the body language. In terms of the data gathering, you didn't miss anything, to be honest, in the data gathering, in terms of the history taking and in terms of the investigations and examination. Very well done. Okay, so pointer. So 3 or 4 in the data gathering. I give always 3. Okay, but you've done it well. Okay, in the terms of the data gathering. In the management, you give me the right diagnosis. Okay. You told me about the next step, what will happen, okay? You didn't touch on the further steps, like maybe, involving OTPT team at the end when you get discharged, okay? So always think about the whole management part, okay? The next step, then the further steps, all right? But in general, you didn't miss a major thing, okay? So 3 in the management. In the interpersonal skills, I would give you 2. Okay, right? So
2 minutes remaining.
the point. Okay, I will give you a tick in the report. Okay, and as a tick in the language, because sometimes I had a difficulty in in understanding the problem. Maybe because maybe because the connection. Okay, so a tick in the language. All right. So if I would give you an advice, just work on this part. Okay.
Thank you very much.
Okay. So this is the only thing that I would advise you. In terms of this particular case, I didn't do many cases with you, but I've done this case with you. A take-home message, just think about the problem that, when you give a big problem to the patient, always give it in a sensitive way, give a pause, and your facial expression should be matching the situation. All right? Like suspected cancer, like dying of some relative, like what? HIV as well is a big problem. What else in my mind? Nothing in my mind now. Always, when you deal with the suspected tumor or cancer, always give it in a sensitive way. All right?
Okay.
It's not breaking bad news. You didn't confirm anything, but
That was
you
Move
have
on
you
to the
have
next
to be a
station.
little bit sensitive to the patient. This is the thing. There is a difference between breaking bad news and being sensitive. Okay? Breaking bad news is giving the information in shots, pieces, and chunks, and pauses, multiple pauses. But are you with me, Dr. Abdurrahman? Dr. Abdurrahman, are you with me? Doctors, can you hear me? Is it from my side or from Dr. Abdurrahman's side?
We can hear you.
Okay,
We
good.
can hear you. We can
All
hear
right.
you.
Yeah, okay, no worries. Okay. So hopefully he got the idea. Okay, so let's talk about the case quickly. Let's read the question. Who are you? Let me close this one because I need to, yeah. Who are you? You are FY2 in the A&E. Who is the patient? Mr. John Smith, aged 75, presenting with recurrent falls. Recurrent falls, okay? Additional information, nothing. Your task, please talk to the patient, take history, find out the cause of the fall, and discuss about the management plan with the patient. So you need to talk to the patient, take a focused history, the cause, and the management plan. There is nothing important here in the examination part, but the important thing is in the history taking, okay? So, what are the issues of this case? You have to find out the cause of the fall. You have to touch on the psychosocial part, please. The patient is old patient. He has recurrent falls, okay? And you have to mention or to link this psychosocial part with the management by involving OTPT team or making sure that there are carers will be involved in helping this patient if he's dependent or he has a problem in daily life activity. Okay. The last thing is the management of the cause. The cause here in this particular case is brain tumor. So what is the management in any suspected brain tumor? CT scan and neurospecialist involvement. Okay? This is what you think about in any brain tumor. Okay? Specialist advice and CT scan. Then OTPTT. All right? Okay. So in the history taking, you will ask about the fall, what happened before, what happened during, what happened after, how did he fall down, and the present history things that we talked about before. Okay, he told you he has headache. So go with it, please. Go with it. Since when you have this headache, and then explore a little bit about the headache, then the patient will tell you, I do have this headache for a long time now. Then you ask about the other red flags in headache. Okay, what are the red flags? Blurry vision, fits as well, because you suspect what? Space occupying lesion. So when you suspect a space occupying lesion, ask about the symptoms of a space occupying lesion. Blurry vision, problem imbalance, chronic headache, morning vomiting, okay, and these things. You can ask about loss of weight if you would like. I mean, cancer symptoms, okay? Then, in the other differentials, you can mention them in your investigations. You can tell the patient, we will do some investigations in forms of bloods and heart tracing. Okay? So, in the data gathering is not only in the history taking. The data gathering is in history taking, in examination, and investigations. If you miss something in the history taking, you can add it in the investigations and examinations. Okay? If you don't have time to ask all of these, put them in the examination and investigations. All right? This is how to manage your time properly. Okay? Then you ask about the injuries, if there is any injury in any form. In the past history, you ask about the medical conditions and the medications. Personal history is not important. 4Ps is not important. Psychosocial is extremely important. ICE, extremely important. Okay? In examination, you will examine the patient, check the observations, especially the lying and standing blood pressure, and examine head, nerves, vision, heart, balance. In investigations, blood and ECG. Okay? In the management, you have to give the management to the patient in a very sensitive way, as I explained to Dr. Abdurrahman. Yes, it is not a breaking bad news, but it is still something which is unpleasant to the patient to hear. Okay? You can tell him, Mr. X, you had recurrent fall. Also, you mentioned to me that you have chronic headache with blurry vision and morning vomiting. All of these are suggestive of something related to the inside of your brain. And give a pause. Let the patient talk. Let the patient absorb. Then the patient will tell you, what do you mean by this, doctor? Then you can tell him, all right, it could be related to some growth or tumor inside the brain. We didn't confirm anything yet, but we need to exclude this course. So would you like to know what is our plan of management in your case? Yes, doctor. Let's talk about what we can do, and then we can talk about what you can do after that. The patient is in the hospital, so you will keep the patient in the hospital, especially if the patient is old age and he doesn't have any carer or anyone who look after him. Okay? If you didn't order the basic bloods here in the investigations, you can add it here in the management. And please CT scan and neurospecialist advice, then OTPTT. Okay? If you have time to talk about what the patient can do for himself, you know, compliance on the medications or on the treatment and compliance on the follow-up. This is if you have time. Okay? Any question? So this case was in the A&E, and the patient has positive history of headache and vomiting and, you know, something related to space occupying lesion. You might have the patient in the GP. You might find the patient is not living alone. So based on what you have, deal with it. All right? Okay. Let's move on to the next one.
Begin.
So,
Hello, I'm Dr. Isra. I'm one of the doctors in this A&E. Are you Mr. Jonathan Black?
yes, doctor.
Mhm. Nice to meet you, Jonathan. Can you confirm your age for me, please?
It's 30.
Okay, thank you. I can see that you are here due to a fall and brought here by an ambulance. Is that right?
Yes.
Mm-hmm. Well, I would like to learn what happened. So, are you comfortable to talk with me?
Yeah, it's okay, doctor. Yeah. What do you want to
Okay.
know?
Mm-hmm. Can you tell me how this happened?
Yeah, I was walking with my wife to the restaurant, and
Mm-hmm.
then all of a sudden I fell down.
Okay. I'm sorry to hear that. Well, just before the fall, have you had any kind of problem, any symptoms?
Nothing. No, I can't remember what happened exactly.
Uh, I mean, any dizziness?
I'm not sure. No, I don't think. I'm not sure,
Mm-hmm.
doctor.
Any palpitations, maybe?
No,
All right. Well, have you noticed any funny smell or like flying objects, maybe?
no, doctor.
Okay, I see. So, have you lost your consciousness?
Yes,
Mm-hmm. Well, I assume that your wife with me, you said that. Well, how much time have you been unconscious?
I can't remember, doctor. I don't know.
Mm-hmm. Okay, no problem. Well, have you had any fit, maybe?
No,
Mm-hmm. Did your wife said anything about it?
she didn't tell me anything.
Any fit? Okay, all right. Well,
Unmute yourself, Dr. Isra.
I'm sorry. Okay. Well, um, so any like after this fall, you said that you are not remember you don't remember the fall, right?
Yeah,
Mhm.
I don't remember what happened after.
Okay, all right. Well, did you vomit
My wife told me that I vomited twice.
twice? Okay, all right. So, thank you for these informations, Jonathan. Well, anything else happened? Well, maybe I don't remember to ask you. Anything you want to add?
And no, nothing.
Okay, no problem. Well, was it the first time you had this fall?
Yes.
Mm-hmm. Okay. So, do you have any medical condition?
No, I don't have any medical condition.
Mm-hmm. Using any medication, maybe, or
No,
including the counter?
no.
All right. Mm-hmm. Okay, so do you have well, do you do exercise regularly, maybe?
Yes, I'm walking every day. I walk maybe 30 minutes every day. Yeah.
Mm-hmm. All right, it's good. What do you do for a living?
I'm a teacher.
Okay, that's good. Okay, so do you have any idea what might be causing this fall?
No, I don't have any idea.
Okay, is there anything concerning you in particular?
No, nothing.
Okay, thank you. All right, Jonathan. Well, I would like to do some examinations and check your body language, body heart rate and your blood pressure and respiratory rate, oxygen level, and temperature.
Mhm.
And then do some examinations such as head, neck, and nerves. Look at your teeth.
Okay.
And and also, okay, thank you for letting me examine you, Jonathan. Well, I can see that you yes, you have some bruises on your forehead. Possibly it's due to fall, and in fact, the fact that you have vomited
Minutes
twice,
remaining.
bruising in your head, and that you don't remember anything regarding this fall, actually a bit concerning me. So I'd like to do some further investigations.
Like what?
Which is a CT, like imaging of your brain. Would it be all right for you?
No, doctor. No, I don't want any CT.
Okay, so may I ask what is the reason?
I'm okay, doctor. I'm feeling fine now. I don't want to do any further investigations. I just want to go home. I don't like hospitals, doctor.
Oh, yes, I understand. I totally understand. Well, yes, it's a bit unpleasant condition you have, and I totally understand that you want to go home as soon as possible. What we want to do is being in the safe side and exclude any bigger problems here. And in order to learn that, we need to do this imaging so we can look at your brain. And actually, the worst scenario would be maybe some damaging in your brain.
Yeah.
And it would be very bad if you have this kind of problem. So in order to be in the safe side, it would be very helpful if you look at the CT.
Okay. Is it
Okay.
mandatory, doctor?
No, of course it's not mandatory. You can, well, it's totally up to you. But
Move
we
on
are
to the next
here
station.
to help you. So
Okay.
it's only just for your well-being. Thank you.
Okay. Time's up. Okay. Thank you, Dr. Isra.
Thank you.
Thank you for your participation. So, how do you feel about your performance?
I feel very nervous actually.
Okay, I felt that, but it's okay because you are performing in front of 50 people, so yeah, no worries about that. Yeah, what else?
Well, history taking was very shallow. Like I could ask so many questions. I just remembered after that, like flaws or maybe vision problem, something like that. But I didn't ask any of them.
Okay.
And like asking flying objects, aura is not necessary, I think.
Mm-hmm.
And also like job is not necessary, something like that. But I really couldn't manage it. I was nervous, a bit nervous.
Okay.
I hope it will not happen at the exam.
Hopefully not, don't worry. Okay, so what else in terms of the management?
In management, well, I can check the understanding
Begin.
and maybe focusing on the concern better, because I only talked, right? I didn't checked enough, I think.
You dealt with the refusal in a good way, to be honest.
Yes.
Dealt with it. You dealt with it. You asked me why, and you tried to explain the situation, and you tried to, you know, make me understand what is going on. So I was not concerned about the refusal part. You did it in a proper way. Okay. Okay, anything else?
Well, maybe mentioning CT is a bit early because doing admission and monitoring something like that, well, basic things
Okay.
needs to be mentioned in the first.
Yeah,
But I thought that like time is
it's going. Yeah, it's running.
time is going, so I need to focus on important thing, which is
Okay.
CT here.
All right.
But I don't know actually if this approach is true. Maybe you can comment on this. Like
Okay.
if time is going, what we need to do, because I really have a problem with this timing.
Okay.
Mhm.
All right. Okay. All right. So I think you have this problem in timing, Dr.
Mhm.
Isra, because from what I found while you are doing the station, that you were thinking a lot
Mhm.
in the history taking part. You are
Yes.
thinking about the next thing. Okay. Maybe this is related to the lack of practice, maybe, or do you practice daily, or what
Well,
would you say about your practice?
yes, nowadays I don't do practice daily actually.
Yeah, yeah. Okay, because the daily practice will help you in just doing everything quickly without thinking. All
Mhm.
right. So, what I would advise you from now till your exam, you still have time. It's 27th of
Yeah,
February. Okay.
right.
So
Mhm.
this is an enough time to just focus on practicing daily to avoid
Mhm.
this thinking. Okay.
Okay.
If someone is thinking about the second thing, this means that um, he's not practicing daily. Okay. So this is what I found in your history taking. You think
Mhm.
about the next point. You think about the next point. This takes time from you, and this will give an impression to the examiner that you are not grasping the station properly.
Mhm.
Okay? So, in the history taking, you missed what? Just a second. Yeah, okay. In the history taking, you didn't ask me how did I fall down? The mechanism of the falling. Maybe I fell down on my head, on any part of my body. Was there any injury to your head or not? Okay, you didn't ask about the red flag in falling. Okay,
Yeah.
so how did I fall down? And was there any injury to any part of your body? You asked me about the vomiting and so I'm happy with that. Okay. Then you asked about the past history. It's okay. Then you moved to the personal history. You asked me about exercise.
So I know.
Okay. So it's not related to the case at all. If
No,
you think
yes.
if you would like to think about the personal history, ask about alcohol.
Yes, right.
Maybe this is a cause. He was drinking. He drank alcohol before going to the restaurant. Okay.
Okay.
Okay. So yeah, in the psychosocial, you asked me about my job. It's okay. It's not a a kind of improper question. It's okay to ask this question. Ideas, concerns, and expectations. The examination and then you didn't mention the investigations, right?
Um,
Bloods and the heart racing.
yes, I think, yeah. I
You
didn't
didn't. You
mention
didn't. Okay, so
Mhm.
my concern is the data gathering in your
Oh.
case. Okay, the
Okay.
data gathering. Um, 2 in the data gathering. Okay, in the management, you mentioned the most important thing, and you dealt with the refusal. So I'm happy.
2 minutes remaining.
I'm happy with your management, despite that you didn't give me any cause of the fall. Okay,
Yes.
all right. So
Mhm.
2 or 3 in the management. Okay, but you mentioned
Mhm.
the most important things. In the interpersonal skills, I would give you 2. I would give you 2 because the hesitation that you have in the case. Okay, the thinking a lot, and but the dealing with refusal was okay, was within the average range. Okay. In consult, yeah. If I talk about the skills, to be honest, you don't have a very big problem in the skills areas. Okay, it is within the average, so I can't give you a tick in a specific thing, but the whole performance was average. It was not super. Okay, it's within the average
Not
range.
enough for
Okay,
the exam.
all right.
Yes.
So what I would advise you is practicing. Practicing from now till your exam, daily practice, maybe 10, at least 10 stations every day, at least.
Okay.
Okay, 10 stations every day. This will help you in improving this kind of thinking. Okay, and will help you in the flow of the station. Okay, all right.
Move
Okay.
on to
Now
the
let's
next
talk
station.
about the question quickly. Okay. So who are you? You are FY2 in the A&E. Who is the patient? Mr. Jonathan Black, aged 30. So he's a young person. Brought to the hospital by the ambulance due to a fall. No additional information. Your task, please talk to the patient. Take history. Assess your patient. Assessment means to find out how is he now in terms of taking the history and examining the patient and finding out the red flags. Okay, and discuss your initial plan of management. Initial. Dr. Isra has done the initial thing, doing the CT, admitting the patient and doing CT. This is the initial. This is the step or the next step in treatment of this case. If the task tells you what is or discuss the further plan of management, further means that you know the steps after the initial step. Okay, all right. So what are the issues of this case? First thing is finding out the red flags. What are the red flags in this case? The red flags of the indications of CT scan. Indications of CT scan. The second one is doing CT as an initial plan of management. The third one is the refusal part, dealing with the refusal part. Okay, these are the things that you have to touch on in this case. Okay, all right. In the history taking, it's a fall. You will find out how did he fall down, what are the possible causes, If he didn't give you any clue about anything of these, please think about skipping meals and alcohol. Skipping meals and alcohol. The patient was going to a restaurant, so most probably he skipped his breakfast and he went to the restaurant. So yeah, if Dr. Isra asked me this question, I will tell her, yes, I skipped my breakfast. Okay, and I drank alcohol as well. 2 causes. Okay, then in the past history, any medical conditions, any medications. In the personal history, if you didn't ask about alcohol, you ask about alcohol here. 4 P's is not important. Psychosocial is minor here. No need. You can ask about driving and job if you would like. Okay, to give him an advice if you have time to give him an advice about the driving and his job. Then ideas, concerns, and expectations. Then examine the patient and investigate. We have talked about that many times now. Then the management. Yeah, we didn't talk about the red flags of CT. What are the indications of CT? The indications of CT: amnesia, fits, persistent headache, vision affection, neurological deficit, vomiting more than once, anticoagulant. If the patient is on any anticoagulant. How to know if the patient is on anticoagulant or not? From the past history. Medications. Are you on any medications? And you can specify, especially anticoagulants or blood thinners. Okay. The patient has amnesia and he vomited twice. So this is an indication of CT. Indication of CT. So it's this is the initial point or the initial step that you need to touch on. CT scan and neuro specialist. Okay. If the patient is refusing, so you go with the refusal. Why he is refusing? Is there any particular cause? And then you talk about the why you need to do the CT, the benefits and risks, and then you make sure that this patient understands everything very well. Then if he's still refusing, no problem. You tell him, all right, it's okay, it's totally up to you. My duty as a doctor is giving you the risks and benefits, and it's totally up to you. If you don't want to do the CT, it's totally okay, but we will need to fill a form, which is refusal, or a discharge against the medical advice, or refusing treatment, if you don't mind. Okay, no pressure at all. Your duty as a doctor is just finding out why the patient is refusing, so you address that, and then make sure that this patient has the mental capacity and understands everything very well. And after that, if he's still refusing, it's not your duty to convince the patient. All right? If you have time, you can tell him after that we will treat you accordingly, and then we can talk about how to avoid the cause and your safety with your work and driving. Okay? We didn't talk about the diagnosis, how to give the patient the diagnosis. You tell him, okay, you had a fall, Mr. X. You told me that you had this fall and you fell down or you landed on your head. In addition to that, you told me you have you don't remember what happened exactly, and you vomited twice. And these symptoms are concerning because these are suggestive of something going inside your brain, maybe something related to bleeding or any damage to your brain because of the head injury. And give him a pause and then tell him, would you like to know what is the next step in the management plan? Yes, doctor. So the best thing is admitting you in the hospital and performing CT scan. Do you have any problem in that? Then he might be refusing, he might be accepting. If he is accepting, you talk about the other points. If he's refusing, you go with the refusal. Okay? Any question, doctors? Okay, so thank you, doctors, for attending and for listening. So yeah, I hope it was helpful for you and it will help you in mastering your technique in your exam, inshallah.
Thank you.
Anything else
Thank you.
before I go?
Thank you very much. Thank you very much.
No worries. Okay.